I'm doing great. I'm doing great. All right, good afternoon, everyone. Thank you very much for joining us on this press briefing about what the state is doing to slow the spread of coronavirus in Nebraska. We've got some important announcements we're going to talk about with regard to June and the new directed health measures for that. But before we get into that, I want to remind people that, again, we've got our 6 rules in place to be able to slow the spread. We want people to continue to follow those rules and use good common sense here. I want to let people know that the sacrifices they have made, the restrictions we have put in place have absolutely worked. We have 44% of our hospital beds available, 38% of our ICU beds available, and 78% of our ventilators available. So we have maintained throughout this emergency our hospital capacity to be able to serve people who need that facility, right? Who need that hospital bed, ICU bed, or ventilator. So thank you very much to all Nebraskans who have been working to slow the spread here in the virus and all your sacrifices. We're getting through this together. It is working. We are able to continue to maintain our hospital capacity. Also, before we get into the new DHMs, I want to talk about the testing schedule. I think I mentioned this yesterday, but for next week, we're going to be in Omaha, Lincoln, Hastings, Kearney, York, Seward, Beatrice, and then we've added on Clay Center for next week as well. So we've got another place for Test Nebraska, so please sign up at testnebraska.com. We want people to get registered. It's less than a 5-minute assessment. The day is going to be kept secure, only used for this testing. And it's also how we're going to schedule people to be able to get tested in testnebraska.com. So please line up for that. And now, we've been getting a lot of questions about what is the state going to be doing for the month of June. And I want to take a step back to the beginning of May. May 4th, we started loosening restrictions in many of the counties across the state. 89 and 93. Well, that wasn't all of them. We got to 89 out of the 93. And we did that in a way to be able to start taking steps to loosening these restrictions so that we continue to preserve the hospital capacity, our healthcare system. And when we said we loosened those restrictions, we needed a couple of weeks to take a look at what was happening in the industry to be able to make sure that, in the state I should say, to make sure that we were continuing to stay stable. And so that 2 weeks was up Monday. So we've actually turned this around from Monday, where we've had the complete data for 2 weeks, to a point where we're now talking about our DHMs for June. So we are turning this around in really pretty quick manner to be able to let people know and give people a chance to plan for what things will look like starting June 1st. So some of the things that are going to remain the same for June 1st will be the guidelines we've already published with regard to things like houses of worship, elective surgery, daycare, and restaurants. So all those guidelines we already published for those will be extended from May into June. Those will all stay the same. We've got a couple of things that will be statewide. So, for example, we've got, one of the things we had was a travel quarantine. Our travel quarantine for June will involve international travelers. So if you are an international traveler coming to the state of Nebraska, we're going to ask you to quarantine for 2 weeks, unless that travel was related to the military, or if it was a connection to travel for work for a healthcare facility. So with those 2 exceptions, if you're traveling internationally and you come back to Nebraska, or you originated from an international destination and came here, we want you to quarantine for 2 weeks. Well, obviously, what that does not include then is people traveling nationally. That also kind of begs the question then, what about Memorial Day weekend coming up here pretty fast? Again, when we put our travel quarantine in place, as I mentioned at the outset, that was really designed to catch people who were snowbirds, maybe coming from Arizona or Florida, and were coming back after having been gone, or people who maybe were out-of-state people coming to visit their cabin and so forth. It did not cover people, for example, who were truck drivers or things like that. People who commuted back and forth between, say, Council Bluffs and Omaha, or South Sioux City and Sioux City, or Cheyenne and Scotts Bluff, that sort of thing. Not intended to count those people. So we're not really putting anything in place here for domestic travel. And again, for Memorial Day weekend, if you are going out of state and you're coming back, if you're going to one of the surrounding states, you're going to Iowa, you're going to South Dakota, you're going to, Missouri, something like that, you don't have to worry about quarantine when you come back to the state. We're really worried about people who don't, use good judgment. Don't go to places like New Jersey, where they've still got lots of spread there. But if you're just going to someplace, use good judgment, take all the proper steps to be able to socially distance yourself. When you come back to Nebraska, you don't have to quarantine if you're just going away for the weekend over Memorial Day. Okay, so hopefully that kind of gives an idea of what we're talking about for travel. Sports. We'd already given some guidance with regard to baseball and softball on May 11th with regard to how those could go. And our DHM will include team sports, and we've actually categorized them by contact level. And we've used the American Academy of Pediatrics. They published a document that had contact sports in it, whether it was non-contact, limited contact, and so forth. And we're really looking at the categories for non-contact and limited contact. Now, that document itself was about physical contact between players or the ground or water or something like that. So it's just a guidance document for us, but it's a good guidance document that we will get out to folks. But it includes categories of sports that will be available, not only baseball and softball we talked about, but tennis and golf. Rodeo will be in that because in the American Academy of Pediatrics, rodeo is a contact sport, but you're contacting the ground, so we're not worried about contact with the ground, it's really contact with other people. So that will be in that category of sports that will be allowed to do, again, following all the same guidelines we already published for baseball and softball. Rodeo will come under the gatherings category, which we'll talk about in a minute as far as how many people can come to see them. But again, for these other sports, following the May guideline, and we'll get that published out to people. So that's how we're going to handle sports. Some sports are going to continue to be prohibited, and those are going to be those contact sports like football or wrestling. And I think we can all kind of see why those get put in that category of being put. Oh, volleyball would be in that category of games that may be part of those limited contact sports. So again, the idea is practice can start June 1st for those sports. Games can start June 18th. So that should be good news. Okay. This will also include, this will be for both youth and adults. So youth and adults will be able to start practice that June 1st in those non-contact or limited contact sports. Competitions June 18th. Contact sports, again, football, tackle football, soccer, wrestling, basketball, those will continue to remain prohibited. School gyms and weight rooms are permitted to be open following the same guidelines as healthcare, fitness clubs, fitness centers, health clubs, spas, that sort of thing. And we'll have, I'll have a little bit more on that here in a moment as well. All right. So starting June 1st, the following guidelines will apply to 89 of our counties. So the ones I just talked about, the sports and the travel, that was statewide. These are now going to be specifically for those 89 counties that we had previously relaxed restrictions on in May, and now we're going to be moving from that phase 1 to a phase 2, okay? So again, we're looking at our little map here, right? So all the dark blue are those counties that are, those 89 counties I talked about, that are now moving from phase 1 to phase 2. So we're going to loosen restrictions in these blue counties. The two health districts, Central Health District and Dakota, are going to be moving to phase 1 where everybody else was in May. So they will have restrictions loosened in line with what we're already currently doing in just about every place else in the rest of the state. So the green will be phase 1, which is what we're in right now. That will be, again, 10-person rule with regard to gatherings, restaurants open at 50% capacity, but not bars. So that'll be the green. And the blue will be phase 2, which will be the rules that I'll be going over right now. Okay? So, bars. Bars, bottle clubs, gentlemen clubs, and so forth will be able to reopen basically under the same rules that apply to restaurants. They'll have to be at 25 people or 50% of the rated occupancy. Same rules as far as 6 feet separation between tables. Patrons will have to be seated at tables. You will not be able to consume food at the bar seating area. Again, servers wearing masks and all that sort of thing are going to be part of our guidance documents that we'll also put out. But again, we're trying to keep, and 6 feet of separation between entertainers, performers, dancers, and then the patrons. So again, keeping that social distancing of 6 feet and a maximum of 6 people at a table. So again, like restaurants where we're saying parties can only be at 6, tables can only be 6, same thing for bars. Patrons seated at a table, maximum of 6 feet, or 6 feet between tables and a maximum of 6 feet at the bar table. Games such as pool, darts, arcade games, and so forth are still going to be prohibited both in restaurants and bars. Gatherings. So we're going to be loosening restrictions on gatherings. Now, gatherings in June will be limited to 25 people, or, and so there's going to be several categories. For certain venues, 25% of your rated occupancy, but not to exceed 3,000 people. So the kinds of gatherings we're talking about for this are going to be outdoor arenas, indoor and outdoor auctions, stadiums, tracks, fairgrounds, festivals, zoos, auditoriums, large event conference rooms, meeting halls, indoor theaters, libraries, swimming pools, and any other sort of confined indoor-outdoor space. So again, all these places have rated occupancies. You can have a maximum of either the greater of either 25 people or 25% of your rated occupancy. But same sort of rules we just talked about for bars and restaurants. You have to limit groups to be no longer larger than 6 people. You got to have 6 feet of separation, separating out between people, and so forth. The types of events or venues that will continue to be banned or prohibited will be parades, carnivals, midways, dances and street dances, beer gardens. They'll continue to be prohibited through June 30th, with the exception of parades, as long as the patrons all remain in their vehicles. So you can still do a public parade like we've been doing for some of the schools, where everybody gets in the car and drives by somebody's house. As long as people aren't lining the street, that's going to be fine. And then also dance recitals. So again, dances are not dance recitals. Dance recitals will be allowed under the same rules of 25 people or 25% of your rated occupancy for that venue. Drive-in movie theaters may be open at full capacity as long as patrons remaining in their vehicles or on their cars while viewing the movie theater. And congregant concessions and restrooms are not permitted. So now, if you are going to have a venue that is going to have more than 500 people, even with that 25% restriction on your occupancy rating, you have to submit a plan to your local public health department. With the exception of being counties that have more than 500,000 people, that limit will be 1,000 people. So basically, in Douglas County, if you're going to have a venue that's got more than 1,000 people, you're going to event more than 1,000 people coming, you got to submit a plan to Dr. Poor, and she's got to sign off on it. Everywhere else in the state, that limit is 500 people, and you got to, same thing, you got to submit that plan to your local public health director, and that person has got to sign off on that plan. Now, I mentioned how school gyms can operate like other gyms, fitness centers, clubs, health clubs, and so forth. They will be able to open up to the greater of 25 people, excluding staff, or 50% of the rated occupancy. So 25 people or 50% of their rated occupancy. But again, same sort of rules that we talked about before. You know, when you've got that gym equipment in there, it's got to be 6 feet apart, all the same sanitation kind of things, all those similar rules we talked about before. Salons, barbershop, massage therapy, tattoo parlors, and those sort of things will be, again, limited to 25 people, excluding staff, or 50% of their rated occupancy. So same sort of deal that we just talked about for gyms. For those salons, if they've got more square feet, they can do it to 50% of the rated occupancy. But again, chairs and stations got to be 6 feet apart. Patrons and workers are still required in the DHM to wear masks at all times. An exception, though, will be made for services provided by estheticians. Patrons will be permitted to remove their mask while receiving services directly. Masks must be worn by the patron at all other times, and of course, the person providing that service, the esthetician, still has to be wearing a mask. So this is, again, if you want to get that facial, you'll be able to do that. But again, and take your mask off to be able to get the facial, but only so long as you're getting the facial. Other times you'll have to have your mask on, and of course the person providing that will still have to be wearing a mask at all times. We also got asked a lot about wedding and funeral reception venues. So these will be in that same category of limited to 25 people excluding staff, or 50% of their rated occupancy, the greater of one of those two, 50% of their rated occupancy. Again, same idea, groups of 6 people seated at a table, 6 feet between each table, maximums there. Self-serve, just like for restaurants, you can't have self-serve buffets or salad bars. All the food will have to be served by venue staff, and no dances. So no wedding dances or other social events that require guests to gather outside of their respective tables are permitted. So again, this will be something where everybody's going to, if you're going to go have a wedding reception, people will have to remain at their tables, again, to preserve that good social distancing. So wedding reception venues will be able to open at that 50% of their rated capacity, or 25 people, whichever is greater, but follow the same sets of rules that we already have established for restaurants. So those are, that is what we will do. We will, again, have, as we've said before, 19 DHMs, one for each of the different public health districts, but for, 17 of them, they're going to look like what I just talked about. The 2 that I didn't mention will be under that, so this is kind of our phase 2 step. The 2 that are not in this will be in the phase 1, which will look like what everybody else is in right now here in the month of May, and that will be for Central and Dakota. All right, so that was a lot to cover, and I'm sure there's going to be other questions. We will be publishing guidance documents like we always do. We wanted to get the notice about these DHMs out, but there'll be additional guidance documents coming out to give some further guidance with regard to what how to implement these DHMs, so we will be following on with that. And then one of the things we've talked about also is that food banks have been put under a lot of pressure right now, given the economic impact that has gone on with this pandemic. People are more food insecure, and so they've been going to food banks. Maybe the food banks are using 10 times the amount of food they were using before and having to find resources for that. The Alliance for the Future of Agriculture, which is an alliance group that includes all of our producers, and I'll let them describe it further, contribute to really promote agriculture, is pitching in to be able to help our food banks with refrigeration capacity so they can take more of those perishable goods. And so I'm going to call Steve Martin up here with the Alliance for the Future of Agriculture, otherwise known as AFAN, to come up and talk about that. Steve?
Thank you, Governor, and thank you for your support of this project. I want to just kind of step back a little bit, describe who AFAN is and what the project is. The Alliance for the Future of Agriculture is made up of all of the leading commodity groups, beef, dairy, poultry, pork, corn, soybean, and Nebraska Farm Bureau. Plus, we have many private sponsors, businesses, and individuals that support what we do. What happened is through COVID-19 and some of the stresses that that's caused on people, the demand on food pantries really skyrocketed. At the same time, we had an incident or several incidents this spring where dairy producers were dumping milk. There was no place for it to go. So a dairy farmer up near Wayne said, "Can I buy milk and send it to my food pantry?" Well, the food pantry, and I didn't know this, but food pantry's #1 requested item is milk. They said they would love to have it, but they did not have refrigeration. So that farmer worked with his dairy association. They were able to come up with some funds and actually bought refrigeration units for 4 food pantries. In doing that, they also came up with a list of 25 more food pantries that wanted or needed refrigeration to do the same thing. AFAN, along with the Nebraska Department of Agriculture, who is also a AFAN member, joined forces with Midwest Dairy, along with our partners, and we were able to come up with a pot of money, basically, and created a grant fund for those other 25 food pantries. Those food pantries serve over 40,000 people every month. And that's a lot of people. And that number is growing. So that is sort of what we've started with. As we've looked at it, we realize that there's other food pantries out there that would be interested in this same product, the same grant. So the grant is up to $4,000 per food pantry. They can use it to purchase refrigerators, freezers, and the associated costs that go with that, like delivery. If there's installation, it will pay for that too. We're asking them to shop at their local retailer, so we create some local business. and then we write the check directly to that retailer, which really facilitates a quick turnover in those units. So what we're doing today is we're rolling this out statewide. Any food pantry that would like to apply for this grant, the application is on our website at becomeafan.org. That's becomeafan.org. It's a very simple application. The other side of what we know is that we don't have the money it's going to take to cover all of these food pantries. We wish we did. We know we don't. So we're also looking for individuals, businesses, associations, anybody that would like to support this project to consider donating. If you're able and it's right for you, we would consider accepting that donation, which we would then use to purchase the refrigerators and freezers for food pantries. The information on where to donate is also on our website, becomeafan.org. The deadline for applications is June 22nd. That's a fairly quick turnaround, but with fiscal calendars ending in June, that's what we really were forced to do. I think we're going to be able to facilitate that. We have a lot of great support in the back end of this and the application process. So again, if you're a food pantry and you would like refrigeration units, please apply. If you're an individual or a business that would like to support the project, please contact us, and we'd love to have any donation you feel is acceptable. With that, I guess, are there any questions on that?
Tell you what, Steve, we'll take that up at the end after we do some of the other questions.
Wonderful. Thank you.
Great. Thank you, Steve. All right, because we will clearly, Steve's not been watching my press conference because I didn't know how this goes. Sorry, Steve, we should have briefed you on this. We're going to go to the questions that were submitted ahead of time first. So first of all, from John Kipper, KMTV. A concert venue in Omaha recently scheduled a show for early June. Is it reasonable at all for people to think that they may be able to go to concerts next month? Or should people expect larger gatherings like this to be banned for some time? So again, John, I think we just put out the DHM. Obviously, you didn't know about that ahead of time. But following the DHM with regard to those concert venues, 25% of their capacity, not to exceed 3,000. Again, and submitting it, if you're going to have in Omaha more than 1,000 people, you have to submit that to Dr. Poor to get that plan approved before you can actually have that concert. So, and the other thing too, just as long as we're talking about this, I would recommend that if you're going to go to a big event like that, first of all, it's a good idea if you're going to go to the store to wear a mask. But especially if you're going to go to one of these bigger events, even though the whole point is to keep people in these groups of 6 people, 6 feet spaced apart, still a good idea to wear a mask. Okay, so that's one of the ways that you can help not only protect yourself, but protect other people as well. It's a respiratory disease. It spreads in big crowds. So again, want to make sure that as we start to loosen these restrictions, taking the proper steps, keeping 6 feet between yourself and other people, wearing a mask, those are kind of things that will help us continue to be able to loosen restrictions by following the rules that we've set out there to be able to help socially distance. So please, as you go to these events, as you look at these loosened restrictions, keep those things in mind, like keeping 6 feet between yourself and other people, and always going to be a good idea to wear a mask. Obviously, if you're going to a bar or restaurant, that's not going to be as practical, but an event like a concert, it should be. Aaron Hegarty, KMTV. What is an updated percentage on claims processed? How many dollars have been spent on unemployment benefits since March, and how many continued claims last week? We usually release our data on that on Thursday, so I'm going to call John Albin, our labor commissioner, to come up and talk about some of these questions. And so, John, can you come up, please?
All right, well, in this last week, we had 5,836 new claims, which continues the downward trend that we've seen for the last 3 or 4 weeks now. So we're not anticipating that, we're hoping that's a long-term trend as well. Continued weeks claimed last week was 60,757 continued weeks. And again, that was down from the prior week when 65,191 claims were paid. So we're again, that seems to be a downward trend. That's a good sign. We're hoping that means people are going back to work. There was a question on benefits paid. If they want total benefits that we have paid since March 1st, that number is $407,881,886. Now, that includes both state and federal benefits. If you just back out the regular unemployment benefits that were paid, that number was $118,648,996 in state unemployment benefits, regular benefits have been paid during that time. There have been a couple questions in the past few weeks about the PEUC program. The PEUC program went up yesterday. We have actually paid some claims on it already, but the major push will come over the weekend because it requires quite a bit of data width, or bandwidth to pull all that data out. So we will make a big run this weekend, and so those.
Can you just describe, John, what PEUC?
PEUC is the additional 13 weeks that a lot of people, pandemic and emergency unemployment compensation, the additional 13 weeks. It's a federally funded benefit available to anyone that's exhausted their claim in a benefit year beginning after July 1st of 2019, or ending after July 1st, 2019. So we'll have to go back and search those people. We'll be making notifications for them. Like I said, we've paid a few dollars out on it already, but the big push will come this weekend when we go back and run all the information through the data, and then we will start paying the big dollars on that come Tuesday, because there's no banks to pay the money for us on Monday because of Memorial Day. A couple questions we've got recently, and I'll just take a little bit of time since I'm up here. One, there's a lot. I know that a lot of the news outlets get a question about why haven't I been paid. One, there's logical reasons like, okay, we're still waiting for the other states that have to provide you your information, can get your payment in. But another thing that is a really common error on the claimant's part, and I don't know how that happened, but it's made real clear when a claimant files their claim that they have to file a weekly certification of eligibility, because that's the way unemployment programs are all designed. And I had an email this morning from someone that said, it's been 10 weeks, why haven't I been paid? So I opened up that particular person's claim, and they had never filed a weekly certification. And
They can file that online, is that right, John?
they can file that online. 99+ % of those are filed online every week. So they need to get out and do that. And then I had another question just a little bit ago about people who are called back to work by their employer and don't go. And I just want to underline again, we've said it in several other press conferences, that is considered a quit. And under Nebraska law, once you quit a job, you're not entitled to any state or federal benefits, and you have to requalify at a later date by earning money in a new job and leaving that job under non-disqualifying circumstances. And there's a very similar rule for if you are unemployed and an employer offers you basically the same job as you had before and you turn it down. That's called a refusal of suitable work. And that is a 13-week benefit disqualification, which disqualifies you from all state and federal benefits. It also reduces the amount of benefits you can draw. So we really want to emphasize to people that if they get that opportunity to go back to work, they really do need to get back to work.
Where's an employer?
Yes, thank you for reminding me. We have a special helpline for employers, or help email address for employers, ndol.uiworkrefusal@nebraska.gov. And if employers would report either a refusal of suitable work, because I know before this all started, employers were hounding us constantly to help them find new workers. And I think as the economy comes back, those jobs are going to be there again. So if you offer someone and they don't take the job, or if you ask them to come back and they refuse, ndol.uiworkrefusal@nebraska.gov.
Oh, John, did you want to talk about the backlog a little bit?
Oh, sure. As of April 26th, we had about 64,000 claims that needed to be processed. As of yesterday, that list of backlog, if you will, is down to 11,559. And we consider that is less claims than we've received in the last 2.5 weeks now. We think our crew has done a great job of getting caught up and bringing things current. It's about I did the rough math using the 538 numbers for new claims filed. That puts us right at about 90% of all claims that have been filed since March 1st are processed. And when you consider that there was, I wrote the number down, 5,800 this week, 6,300 last week, and plus this new claims, we're basically the equivalent of 2 weeks' worth of claims to be processed. And so, we're optimistic that at some point in the not-too-near future, we'll be back down, not under our 28-day standard. Not too distant future. Sorry, Governor. We'll be back at not just to the paying within 28 days, but down to paying within 21, because that's the ultimate goal. So with that, I'll sit down. Oh. Actually, I ran a calc on that. Just to give you a background on my figures, the USDOL has a report 9052 is the report number, and it goes first payments, and it goes from the date that the claim is established, and running that back from March 1st through May 21st, that means we were at 85% have been first payment within 28 days of the payment. So I think we're hitting the mark. The big thing, and I know all the news outlets here, is because from various claimants that haven't got paid, and it's like if you're hitting 85% of 100,000, or actually in this case 121,000, that still means there's 15 to 16,000 out there. So that didn't get paid within that time span. So that's the number we're working for, is to try and get that up into the 90s where it was before the whole pandemic outbreak.
Thank you, John. Okay, our next, sorry, that was the old question. Next, Aaliyah Conley, Omaha World Herald. I wanted to know if Governor Ricketts has met either in person or virtually with meatpacking workers since the pandemic has begun, and if not, does he plan to do so? And the answer is yes. If so, which plant did he talk to, or conversely, if he has a plan in the future? So we met with a group of folks by phone, so we didn't meet in person. I can't tell you which plants specifically were all represented. I know one of the folks on there was somebody representing the Smithfield plant in Crete, but I can't think of the rest of the ones there. But we have had those conversations. Liliana Pearson, WOWT, with Memorial Day around the corner, could you please address the do's and don'ts of cookouts, volunteering, lake gatherings, and other common activities? So again, we still got the 10-person rule in place for the month of May. So please keep your gatherings to 10 people or less here for Memorial Day. So best practice would actually be just members of your household, but I know people are anxious to see their friends. So if you do have people coming over or going to somebody else's house, please keep that group size to 10 people or less. And that would be the same. I know that the Game and Parks has opened up some of the tent grounds. We want to continue to keep those group sizes to less than 10 people, or follow whatever guidelines they've got out for that campsite. It may vary. 6 feet distance between you and other people. Wash your hands often, 20 seconds at a time. Make sure you're coughing into your elbow, all the good hygiene stuff. If you're going to be out and about, again, if you're going to the store, wear a mask is always a good idea. All those kind of things that we've talked about before, please continue to practice those things. I mean, one of the things we've seen is Nebraska's been great about following the guidelines and rules we put out. And that's allowed us to really slow the spread of coronavirus here in Nebraska. And that's why we can loosen these restrictions. So by continuing to follow these guidelines and these rules and these DHMs and all the restrictions we put in place, and I know that people are tired of it, but by continuing to follow those, that's how we can continue to loosen restrictions going forward. So we're taking another step with the DHMs that I announced today into June to continue to loosen restrictions. We have to continue, though, to remember to practice those good things we've talked about with regard to 6 feet of distance, and all that. So please continue to practice those types of social distancing guidelines, so physical distancing. From Nicole Ebat from KPTM. An Omaha layer is claiming it is not legal for officials to hold someone criminally liable for breaking the DHMs. He has a number of reasons he cites: the First Amendment, right to peaceably assemble, separation of powers. He says the legislative branch is the only one that can make laws. The executive branch can enforce laws but cannot create a criminal offense. Void for vagueness. He says the DHMs do not exactly specify what defines public gathering, who is criminally liable if it is broken in the establishment, the owner or the patrons or both. So again, I would say that in times of emergency, which we've got a declared emergency, not just in Nebraska, but across the entire country, it is well recognized within the Constitution that government has powers that it doesn't ordinarily have. You can think back to like the Civil War and Abraham Lincoln and waiving the writ of habeas corpus and due process and all that sort of stuff. There's certainly, when you're in a time of emergency, it is recognized, and that's why we try to keep the times of emergency down to only things like when we have pandemics or when we have in limited areas where we have floods or things like that. So I would say that it's well recognized within the Constitution that the kinds of things we're doing are absolutely appropriate to be able to do. Mark Bomber, KSNB. Taylor, I suspect you already have a question from someone else, but Mayor Steele in Grand Island has reportedly said this morning, I presume that means this morning, that he's going to ask Governor Ricketts to ease the DHMs for Grand Island community. Again, we've talked about that already with regard to the Central District moving into that phase one that has loosened restrictions. All right, so, and I did talk to Mayor Steele this morning, or this afternoon, to give him a heads up about that. Taylor, texting questions.
Ryan from KGFW wants to know, how do you find a balance between loosening restrictions and not overwhelming the healthcare system? And that's his question.
All right, so Ryan, KFGW, wants to know, how do you find that balance between loosening restrictions and not overwhelming the healthcare system? And that, of course, has been our whole goal the entire time. Again, I've used the analogy of 5 miles an hour on the interstates would end nearly all of those traffic deaths. We've essentially done that with regard to this emergency, right? We've slowed society down to 5 miles an hour, and it's worked. We've preserved the healthcare system. Now what we're trying to do is find that right speed as we start to loosen up these restrictions. So we'll continue to look at the hospital data. It's one of the things that we focus on is where we are with hospitals. If you look broadly across the state, the hospital system is very stable. We're continuing to watch what's going on in Douglas County and working with the hospitals there to manage that. But in general, we've done a great job of complying with the restrictions and therefore preserving the healthcare system. And so now what we're doing is taking that step, loosening those restrictions a step at a time, seeing what happens with regard to that hospital system and so forth, to be able to see if we can take the next step. So that's what we did May 4th. We loosened the restrictions. We actually saw everything stay stable. So now we're loosening more restrictions for June. And we'll look at the data for June and see what steps we may take in July. So that's how we find that balance.
Jeff from KMTV says there's been people waiting for unemployment for a long time to the point of giving up. What do you say to those people?
So again, for the people who've been waiting for their unemployment checks, I think John talked about it already. I think especially if somebody's been waiting a long time, it could be that certification issue that they were talking about. Maybe they haven't gone in and recertified or certified that they are still eligible for unemployment. As in the case of the person who contacted him with 10 weeks, hadn't been paid, well, there was a reason why. So, and again, I would say that what we're looking at with regard to the backlog is really getting to the last 2 weeks, 2.5 weeks or so, we're catching up. So if you actually haven't gotten paid, there might be something wrong with your claim or some other reason why you're not getting paid. And then go to the website. It should have a status on there to be able to do that. Is that right, John? The website should, except if it's like that 13-week thing, that if you got that 13-week extension, that software just got put in yesterday. Those claims, as John said, will be processed over the weekend for the most part. I think some have already started being paid, right, John? Yes. Some of them have started being paid, but primarily they're getting processed over the weekend. So if it was the 13-week extension under the pandemic unemployment, what was that? Pandemic Emergency Unemployment Compensation, PEUC. If it was that program, then just be patient until next week, because if you were looking for that 13-week extension, we should be getting that processed and getting it paid next week.
Don Walton wants to know what the hospital beds, ICU, ventilator stats are for Lincoln and Omaha.
So Don Walton wants to know what the stats are for Lincoln and Omaha with regard to hospital beds, ICU beds, and ventilators. And Dr. Antone, can you come up and please share that data?
So as the governor mentioned, the area of most concern is Douglas County, Omaha area. Lincoln, Lancaster is very well preserved. As a matter of fact, Lincoln has 156 out of their 378 beds available, and
What percentage is that?
that's a 41% availability in Lincoln. For hospital beds, a 46% availability for ICU beds in Lincoln, and they have 193 out of 230 ventilators available in Lincoln Lancaster. Douglas County's approaching.
What percentage is that?
That is 60, no, I don't have that number down, but it looks like close to maybe 60% of their ventilators available. Even better than 60%, maybe 65%. Douglas County is reaching close to a 30% bed availability in general beds and in ICU beds, but we still have 62% of ventilators available in Douglas County. When talking with the CMOs, and I talk to all the CMOs almost every day now, especially in Douglas County now that that's a concern, they're not so concerned about the actual physical beds that are available. That is truly available. But some of the staffing now, especially with all the work they've been doing and all the overtime they've been doing, the staffing's getting a little bit staffed, so they might decrease the bed availability based off their staffing needs. But I've visited their hospitals. They're doing a great job. You know, we're keeping track of everything. After some of the restrictions were relaxed, a lot of patients, even non-elective surgery related, came into the hospital. There's still a lot of patients coming in with acute emergencies like traumas, heart symptoms, heart attacks, neurologic problems, things of that nature. So we're watching that very closely. And
You want to give out the numbers, the specific numbers of beds and so forth?
For Douglas County, there are 437 general beds available in Douglas County. That's about a 28%, 29% availability. ICU occupancy
How many total available?
out of 1,676 total beds available. And in ICU, there's 76 out of a total of 365 beds available. And again, those are staffed beds. That means those are the ones that they currently have staff for. They can go to staffing agencies if they need to staff that up to make more beds available. And I think I mentioned the ventilators, 193 out of 311 ventilators available in Douglas County, a 62% availability rate.
Do you have the data on how many of those beds are being used for coronavirus patients?
I do. Currently in Douglas County, 134 beds are currently being used for COVID-positive related patients. Of those, 43 of those 134 patients are on ventilators. So again, very few of the COVID patients are really using up the hospital resources. It's a lot of the other issues, medical issues, that have started to come in too, albeit we do know the number of positive patients coming into Douglas County hospitals is on the rise. It's the only place in the state where it is on the rise right now is in Douglas County. Every place else in the state is declining as far as bed availability goes. We've mentioned this before, that every hospital is cooperating, every hospital is sharing, even within systems or between systems if that's what's necessary. So again, it's my main focus of concentration is working on the bed availability rate. And, as I work with them every day and, just great cooperation. And again, just to thank all the staff that I've seen in the hospitals that I visited. I know how hard you're working. We really appreciate it. And, hang in there.
We have some questions for John Alvin now.
John, come on up, please.
Beck at NET would like to know about the software for the 13-week extension. Is it different than what was put in place for the $600 weekly payment? And will a person's 13-week extension be retroactive?
Okay. The question was, is the software different for the PEUC program as opposed to the FPUC program? And the answer is yes, it's different software. It's a different federal program. It has to be tracked differently. So it's a completely independent set of software within our suite of software. PEUC is not only retroactive to the date they filed their claim, technically, under the Federal CARES Act, it can be retroactive to any benefit year ending after July 1st of 2019. So there's a reach back period, and one of our obligations going forward is to try and identify some of the claimants who might be eligible for that. PUC payment. So that's our next project for next week.
She also has a question from a viewer. The person is a self-employed licensed massage therapist returning to work. Her clientele is significantly reduced. Can she still be eligible for partial payment?
The short answer is yes. The question is, okay, it's a self-employed licensed massage, oh, come on, why can't I get? Salon, okay. And their question is, they've gone back to work, but it's a reduced amount of income because of the patient, or the clients, normal clients are staying away. The PUA, which that self-employed is under, is treated just like the regular unemployment, and that is, as long as the earnings that you have do not exceed your weekly benefit amount, you will be eligible for at least a partial PUA benefit, and in addition, if you're eligible for $1 PUA, then you're eligible for the entire $600 FPUC payment on top of that.
Is that good, Taylor?
Yep. We have a question from Sherelle at KBTM. She wants to know if takeout alcohol is still allowed.
Sherelle, KPTM wants to know if takeout alcohol is still allowed. It absolutely is during the duration of the emergency.
Christina Stella from NET says that some Latino activists had a news conference today on the treatment of meatpacking workers, saying people have been treated as expendable. Do you have any reaction to that?
So I'm sorry, Christina
Stella with NET.
Christina Stella, NET, said there was some activists for the Latino communities that had a press conference and said that food processing workers are being treated as expendable. And did I have a reaction? And I will say that, hey, we have been working very, very hard with all the food processors here in the state to be able to establish the best practices. For example, UNMC's Global Center for Health Security said that, or has published their meat processors COVID-19 playbook, which is the best practices document that we have been sharing with all the food processors and working with them to be able to start implementing all those practices. We've talked about employment practices as well, such as not dinging people for missing work and that sort of thing. Make sure there's pay for staying home at sick or short-term disability, something like that, to be able to make sure that people are not incented for coming in being sick. So, and of course, all the workplace steps to be able to put up plexiglass between workstations, plastic in lunchrooms, everybody wearing masks, sanitizing surfaces, all the steps to try and take what is admittedly a very difficult environment to be able to socially distance and be able to put those steps in place to be able to help with worker health and safety. So there's a lot of things we've been working on to be able to make that happen.
Julie Anderson from the World Herald wants to know what the impact we've seen from loosening restrictions on May 4th, and do we expect more impact from this new round of loosening?
Julie Anderson wants to know what has been the impact of loosening restrictions since May 4th. And again, if you look at the data, you can see our hospital system has actually become more stable, with the exception of Douglas County, where we're kind of watching some of the number of cases there. And just in general, if you look at what's happened around the state, it's actually been more stable in May than was earlier to that, so for at least the last couple of weeks. So actually things have gotten more stable over the course of the last couple of weeks, which has led us to believe that we can start loosening some of these restrictions.
And then finally, Grant Schulte wants to know who we're working with in setting these new relaxed DHMs, and why are 4 counties that still under tighter rules? So
Grant Schulte wants to know who we're working with regard to establishing these DHMs, and why are 4 counties still on phase 1. We work with a variety of people with regard to crafting these DHMs. So, for example, we work with all the local public health directors. We talk to the folks at UNMC. We're on calls with them daily, actually, with regard to how this pandemic is continuing to impact the state and what the state is doing to slow that spread of the virus. We work with industry groups when we're trying to come up with what the DHMs are. So there's a variety of people that have input that we seek into crafting all of this, that Dr. Antone and his department work on to pull all this together, to be able to put these things out. And again, you can see that if you're contacting and working with that many people, why it takes some time to pull these things together, remembering that Monday was the first day we had 2 weeks worth of data, and why I believe that we're turning these things around in a fairly quick manner to give people a chance to plan for June 1st. And then the question was, why are these 2 health districts still on phase 1 versus phase 2? These 2 health districts had been particularly impacted by coronavirus, as I think we're all aware. And so, again, we're taking this a step at a time. We had the other health districts go through some time, at least in May, with the relaxed restrictions. And that's why they're taking the step into phase 2 as we go into June. These two districts have not, and so they're taking that first step, that phase 1 in June. So that's why we're breaking that out with regard to understanding that this virus doesn't spread uniformly across our state. And so in these two districts, we felt that it was prudent, working with their local public health directors, to have them go into phase 1 starting in June versus jumping straight to phase 2. Is that it, Taylor?
That's all.
All right, questions from the room? I know that was a lot. All right, Paul.
I miss movie houses. What are you doing for those?
So again, movie theaters will be part of the indoor venues that we talked about, 25 people or 50% of your, 25% of your rated occupancy. And then, again, ticket 6 people in a group, 6 feet of space between groups. So again, I think in a movie theater, easy to be able to kind of manage this. And of course, I would recommend wear a mask.
And I get this question a lot from people, and they go, isn't it a given that once you relax these DHMs, you're gonna see more infection, more death?
So the question was, isn't it a given that you're going to see more, as you do relaxation, you're going to see more infections? Again, folks, we can't stop the infection from coming. It's a virus. You can't stop it from coming. We've been very clear at the beginning. Our public health officials were very clear 3 months ago that you can't stop this from coming. But you can slow it down to preserve the healthcare system, and that's what we've done. We've preserved the healthcare system. We're trying to find that right speed now by allowing people to, go back to a more normal life by loosening some of these restrictions. The flip side is, first of all, the people who say, well, I want no infections and I don't want anybody to die, that's just not realistic because it's a virus. You can't stop the virus from coming. And the other thing is, if you lock down too long, like we've seen in other states, then people start ignoring your DHMs. So we want to strike that balance to be able to start loosening restrictions so that people can go back to a more normal life. And by doing that, have them comply with the DHMs we still do have in place, rather than people just throwing the whole thing out.
How much does that weigh on you? I mean, the chances are there will be more deaths, won't there? I mean, how much does that weigh on you when you try to?
So the question was, how much does that weigh on you? And again, think about our traffic deaths. We know that we have traffic deaths in the state every year. Yet we still allow people to drive back and forth between cities. We allow them to use the highways and so forth. So again, what we're trying to do is find what is that right speed to allow people to be able to go back to a more normal life and still preserve the healthcare system.
I think about a week ago, when you first, you were asked what would cause you to retighten, and I think your answer was, or maybe it was Dr. Hampton, said that 30% of hospital capacity would be a benchmark that you'd watch for. Well, you're getting below 30% in Douglas County, but you're going in the opposite direction. You're doing more loosely, not retightening. Why is that?
Yeah, so the question was, hey, about a week ago, I think it was Dr. Antone said 30% would be one of those kind of benchmarks we'd look at to start, maybe we'd need to retighten some of the things, yet we're kind of hitting that benchmark in Douglas County, and yet we're still loosening. And again, I think it gets back to facts and circumstances. In fact, I followed up with that question saying, hey, we might change it from 30 to 20 and so forth. So I did say that that was something that we would adjust. But also having said that, we're looking into and working with those hospitals in Douglas County. That's the first step. I've always said, when it comes to these things, the first step is opening up communication. For example, people have asked, if I see a gathering of 50 people, should I call the police right away? And I'm like, oh, why don't you try and work with the person who's organizing the party first and see if you can't get them to get to where you want the guidelines to be. And that's the same thing, the same approach we're taking here in Douglas County. We're going to work with the hospital system. We want to make sure that we understand all the things that are going on. So for example, and Dr. Antone, I've had this conversation, you might say, well, you really haven't had that many cases in Douglas County. Less than 10% of the hospital beds are being taken up by coronavirus patients. So that's not necessarily what's driving this, right? Well, is it elective surgeries? And you maybe need to take a look at elective surgeries and slowing those down. Well, even that's not the complete answer, because what we're seeing is there's a lot of people who have put off going to the hospital that are now going in, but it's not elective surgeries. It's people that maybe have a heart condition or something like that, and those are certainly not people we want to prevent from going to the hospital. So it's not as cut and dried as just, oh, it's elective surgery or it's coronavirus patients. And so that's where we want to have the opportunity to be able to work with the hospitals to figure out what is the solution, what is the best answer for making sure we're providing people that health care they need, but still managing that hospital system to make sure we can take care of the people who are coming in for coronavirus as well.
Also, are any of the health districts wanting to hold on to tighter restrictions? You're allowing this, but they have a certain leeway.
So the question was, are any of the health districts going to have tighter restrictions than we've put in there? And the answer is no. We've worked with all the health districts to try and keep it uniform with, obviously the 89 counties in dark blue are going to be going to phase 2, with the exception of those 2 health districts that we're stepping into phase 1, which are tighter restrictions than what the rest of the state is going to be under. Yeah, Lee.
These DHMs apply to collegiate athletes as well, so you have SEC, or you have the NCAA putting in the lifting of restrictions for your contact sports, but you here have contact sports not being able to be permitted. What is the overlap and how should that be applied?
Yeah, so obviously with things like collegiate and professional sports, with regard to the people gathering there, that's going to be falling under the gatherings, so the 25% occupancy, rated occupancy, and also for the, 3,000 person limit. With regard to actually practicing those sports, again, if you're in one of those contact sports, whether you're at the collegiate or professional level, we are still prohibiting that in the month of June. So, but for other collegiate sports, like say collegiate baseball, you would be able to have a gathering that would fall into that category of 25 people or 25% of your rated occupancy.
We're football crazy here. What can you tell people about Nebraska football? They're gonna be able to practice in July maybe, or August?
So the question is, what do we think is going to happen with regard to Nebraska football? I actually believe that we will have a season this fall, but again, we're taking this a step at a time. We want to take this a step at a time so that we can find that right speed. So that's what we're going to be doing with regard to that, and we'll work with together with the university and so forth.
What's your greatest fear in relaxing these restrictions?
Well, so Paul just asked, what's my greatest fear with regard to relaxing these restrictions, is that, again, we just have to make sure that we're finding that right balance, that we're letting people return to a more normal way of life, and that we continue to control the spread of the virus so that we can manage it within the healthcare system. That's our whole goal.
But you still want people to wear masks, aren't you concerned that people will say, happy days are here again?
So I'm still recommending that, hey, say if you're going to go to that movie theater, wear a mask, still a good idea, or if you're going to go to the store, wear a mask. Am I worried that people are going to just throw this off and forget all about our rules? I don't think so. I mean, I think one of the things you've seen, at least I've seen in Omaha, and I think it's been true in other parts of the state, is that as we've relaxed these restrictions, people have been cautious about it, and I think that's a good thing, and that by actually releasing restrictions, we will be able to solicit people's help with following the restrictions we still have in place, versus that if we just said, hey, we're just going to lock everything down and not let anybody out of their house, then eventually you just have people ignore your rules. And really what we need is that voluntary compliance from people, because we don't have enough police to sit on everybody's doorstep, and the police don't want to sit on everybody's doorstep and tell them what to do. That's not the way we do things here in this country. And Nebraskans have been asked to sacrifice and to follow these restrictions, and by and large they have. And we want to loosen these restrictions and continue to solicit their help on making sure we slow the spread of the virus.
Here's time for a last question.
One last question. All right, Paul, I looked at everybody else. Nobody else wanted to ask it, so you get the last one. Fred's giving you kind of a dirty look, though. Did you notice that?
So we got a sports writer doing a story about life without baseball. I know you're a big Chicago Cubs fan, your family owns a team. Can you talk about what life's been like without baseball this year?
So Paul's asking, what's life been like without baseball? He knows I'm a baseball fan. I got to tell you, it is tough. We've been very busy here. I think that if we can get a baseball season, that will be a huge morale boost for the country, even if it's somehow limited in some way. Again, I think what it'll represent is kind of getting back to that more normal life, that we all want to get back to a more normal life. And I think that seeing baseball on TV, even if we couldn't go to a game, would be able to help us do that. So. And Paul's asking, I've been watching all games. As a matter of fact, I did go back and watch Game 7 of the 2016 World Series. It was nice knowing the outcome of that one. All right, folks, thank you very much. Appreciate you all coming here. Again, we will be back here at 5 p.m. Central Time for the Spanish language briefing. I'll be on NET at 8:30 tonight with Dr. Angela Hewitt from UNMC, and then also Felicia Quintana-Zinn, who is going to talk about contact tracing. Tomorrow, 2 p.m. here. And then, of course, next week, we will not be here on Monday. It's Memorial Day. So we'll be back here 2 p.m. Central Time for an English language briefing. Thank you all very much, and have a good evening.